All right. So, getting started, just draining some of the fluid around just like my uterus, my belly, right?
Yep.
And then let's do it.
Sounds great. So, when you have a baby, all your organs kind of move around because they need to make room for baby.
Exactly.
So what happens is your muscles change, plus your organs do too. So big ones that I want to clear when we have a new mom here, which honestly all new moms should get lymphatic drainage because yes, 100%. Because a lot of our bodies will hold the water weight, and then you think that something's wrong with your body, something's wrong with like your workout program, something's wrong with your diet, when really it is often that water weight retention that has not been drained. Right?
Yeah.
So big things for me we are going to talk you through is what are the big muscle groups we want to clear. And the good thing about that is not just it doesn't just help with draining liquid out of here. It gets you farther in whatever training you're doing. Whether you're trying to run better, lift stronger. Once we get your abs functioning better, you'll do better, with your home workouts, with bar, whatever, with lifting, whatever your chosen fitness routine is, you will do better. And B, your belly just heals better. And in long term, health wise, your uterus, your gut will just be in so much of a better place because they can breathe now versus being squished and tightened and pulled in all these different directions.
I love it.
You want to see how that looks?
Let's do it. Let's do it.
Okay. Awesome. So big things for a postpartum body is your abs change. We all know this, right? So we have recti muscles, 2 of them, 1 on each side, and these usually elongate and split, right? We know this is called diastasis recti for those of you whose bodies don't heal as well naturally. And we can always still heal with exercise, right? But anyhow, those are the recti muscles. They stretch and they separate. Now, the problem comes because no one thinks of the obliques, because these are our ab muscles. They are a little smaller, but they are very, very crucial for your abs to be optimal. Again, this is something I hear time and time again in my office is I'm doing my ab workouts, but my belly won't look as it does. And that's typically, yes, the mom pooch. So real. And that's usually because the obliques, so the external obliques go from your ribs. They are these fan-shaped muscles that go from here down to the pubic bone on both sides, right? We have the internal obliques, which go from each ridge of the hip. They are fan-shaped and they go up towards the ribs and the sternum. Now these fan-shaped muscles, what happens is because they are fan-shaped like that, they scrunch up. And that's why people say, oh, my ribs hurt. As baby starts growing, you get that feeling of baby's up in my ribs. Yes, that's because your muscles are all scrunching and getting pushed. Exactly. That muscle shrinks and pulls up under the ribs. And yes, depending on which side baby is lying, you may feel that more on one side versus the other. But all moms who carried their babies to term will have this. So we clear the obliques. Okay, and we can have you bring that over so we can see a little zoomed in view. So during these sessions, this is different from an average lymphatic drainage session by a massage therapist because they typically don't have the training to treat the actual organs of the abdomen. So do not try this specific technique yourself, or again, if you're one of those adventurous folks who wants to try it, but if you have any discomfort, any pain, then please stop and see a professional, because nothing that I do here with Sam is going to hurt her, right? So I'm going to try and focus on this oblique first on her right side. So I am going to engage her ribs because the muscle goes from her ribs to her pubic bone. So I engage and I sink in like so to see under those ribs, what are those muscles looking like? There we go. And I'm going to muscle test and help them lengthen. So Sam, I'm going to ask you to take a nice deep breath because I feel a spot of tension there. Good, beautiful. Inhale and go ahead and exhale. Wonderful. And as you can see, and Sam's gut and exhale and breathe normally. Sam's gut is in a good place, meaning she's not retaining a lot of fluid right now. If she was, you can see how that would help get that out And then we would check the other oblique, which would look similar in we relax the abs, allowing the practitioner to sink in and check for any tension spots. So again, not just the water retention is what is cured by this, but if she had any tight spots in her abs, which she actually did a little bit, but we fixed it, right? Go ahead and inhale. Beautiful, beautiful, beautiful. Stay and exhale and relax. Beautiful. There we go. And see how, there we go. So we would do the same thing in the groin as well. Now this is an area that has a lot of tension often for people, even non-pregnant people, people who run and who lift. Basically, if you're using your hips a lot, then this area gets tight, the abs. And because these ab muscles are tight, your hips are kind of held in, not allowing them to open as much. So when we do this, we add in some active hip motion to help that release be a little bit more functional, right? So this time, I'm just going to do this, and yep, we'll do that little maneuver. Wonderful. So there we go. I'm going to engage the abs. I'm going to, have you take a nice deep breath, Sam. Nice and easy, beautiful. Stay, and I'm going to do just a tiny release here. Exhale, exhale, exhale. Beautiful, yes. Good. And we'll do that one more time. You can relax that leg out straight. Yep, wonderful. I'm going to relax my hold because that one spot we were releasing first has now calmed down. So I'm picking a different trigger point. And again, this is why go ahead and try these techniques. I hope it helps, but you may need to see a professional because it is very specific. It is kind of diagnostic. So I am right now on her pubic bone on a very specific trigger point, and I'm connecting that with an area of tension in her abs. So here I'm going to engage the two together, right? So go ahead and take a good deep breath. Sam, thank you. All the way down. Beautiful. So with her breath, what Sam is doing is she's internally stretching that fascia, those ligaments that hold these structures in place, and she's causing a nice relaxation, as you can see. So go ahead and exhale. Wonderful. So much better. While doing this deep work, I'm literally like 2 inches inside someone's belly. I've had people fall asleep because it is just so relaxing.
It's so relaxing. I could totally fall asleep.
Yes, it is so relaxing. And the magic of that is because serotonin, a good amount of it is made in the gut. Our relaxing chemicals, our relaxing hormone. So when I release restrictions around the gut itself, you get better blood flow. It helps to get that serotonin cycle going, and people get into this nice groove where they feel relaxed and sleepy and just so much better. So with the lymphatic drainage, we would again clear all creases, all the corners of the lymphatics. Again, like I mentioned, exhale. So that you saw Sam have a little catch in her breath. It's because we hit a sensitive spot.
Yeah.
So I'm just going to hold that. Go ahead and inhale. So this is never going to be painful. Go ahead and exhale. However, we may be in slight positions of discomfort for like a few seconds, but only discomfort that you can breathe through. Because we cannot heal pain with pain, right? So I never want the body to be in pain. Wonderful. Go ahead, little bit more breath. Good, good. And I'll have you inhale under my fingers. Wonderful. Stay right there and exhale. There we go. Wonderful. So this is what a lymphatic drainage session looks like from the outside. Of course, most people, especially most postpartum people, will benefit from some internal pelvic drainage. That's because, hey, our uterus did most of the growing and moving, right? And we can literally go right around the cervix, in the vaginal canal, make sure there are no little tight spots anywhere, there is no pocket of fluid, because, even if everything heals well, sometimes people have those complaints like, sex feels a little different, or my orgasms are there, but they're not as strong, so there's literally, it's almost like your poor little nerves are getting a little strangled by these pockets of liquid that just kind of hang out, and that's why moms will say things like, I just feel a little heavier down there. So yes, you may not be like leaking, you may not be having pain, but things just seem like off or just different. And then we are taught like, oh, you're just different and nothing is, yes, this is normal.
It's normal postpartum, like
Exactly. And yes, your body will be different than it was pre-pregnancy, but you need to heal. You should, if you carried a baby, you deserve the care it takes to heal from carrying a baby and birthing a baby.
Yeah, exactly.
So the lymphatic drainage, we would focus on the outside and then go on the inside. So again, all our organs, not just in the abdomen, but specifically in the pelvis, the uterus, the bladder, the rectum, they are all healthy and happy. They are not getting pulled in certain directions. They're getting good blood flow and they're getting good lymphatic drainage out. So I literally have had people who came in, they literally had one session and they text me like, oh my gosh, I had my first run without peeing, and they didn't even have time to do any exercise. And literally what changed was they didn't have a little pocket of fluid sitting on their bladder that went boom, boom, boom when they ran, So something as simple as someone just doing like a 45-60 minute drainage on you, it can help you run better, like without leak, without pain. And that specific person I'm thinking of, again, she didn't change anything in her exercise routine, but she could go faster and she could go farther, which was just like so like amazing to her. But I'm like, yes, your muscles are just working so much better now. So that's just my 2 cents, that if you have done the hard work of growing a human being and giving birth to them, allow your body to heal. You are not doing yourself or your child or your family any favors by not needing, like how we feel like, oh, we should survive and we should not need this. I should be able to just do stuff, with self-care. Like, yes, self-care is fabulous, but sometimes let others care for you.
Yeah, exactly. I